Does. Thank you for being here today, and appreciate Senator Murray you giving me this opportunity. Um, uh, Dr. Levine, are there school districts that are open in Pennsylvania and some that are closed?
Well, Senator, thank you for your question.
Just we're short on time. So, are there school districts some open, some closed?
There are some school districts which are remote and some school districts which are in person.
Okay. Has there been a public health analysis to see those that have been open? Has there been a massive spread of COVID that's different than those that have stayed hybrid or all remote?
I'm not aware of that analysis, but
Okay, if that's my impression as well, which is across the country, we've had some school districts open, meaning kids going to school, others absolutely closed, kids only going on remote. The evidence doesn't show so far that those that have been having kids in classrooms are seeing a spike in COVID cases. There are also countries that kept their schools open. They haven't seen a spike in COVID cases. I don't understand why our schools are still closed. There are some of us who feel it's a submission to the teachers' unions, and because they're such big donors to the Democratic Party, that the administration is saying, oh, we're not at state levels, at the federal level, we're not going to push to get our schools open. But you know, grocery store workers are working, drugstore workers, taxi drivers, EMS workers, healthcare workers. But there's just as much a priority for our kids to be educated. And I just can't understand why, given the fact that the data doesn't show that there's a problem for teachers or for families having kids going to school, we got to get our kids into school. The administration is proposing $170 billion going to education as part of the 1.9 COVID program, but only 5% of that is getting spent in this year. 95% is for years down the road. It has nothing to do with getting our kids safe and our schools open again. I don't understand why the administration does not directly encourage all of our school districts to open again. And if we're going to send out $170 billion, which I don't support, but if we're going to send out $170 billion, it ought to be linked to them agreeing to get their doors open and get the kids back in the classroom. That's my chance to make a point, and hopefully you'll take that point to the administration in the responsibilities you have. Let me ask a question of Dr. Murphy, and that is, you've had concern, as I have, about kids vaping. And the analysis shows that about 1/4, I guess, of high school kids are vaping on a regular basis tobacco products, and in many cases marijuana as well, particularly at the higher grades for marijuana. What can we do to get the flavored vaping products off the market? That's what kids are getting into. This has been slow rolled by the prior administration. I think the prior administration was so concerned about the vaping shops and the adults that wanted to use the flavored products that they slow rolled this. But how are we going to get vaping products that are flavored off the marketplace so we don't addict our kids to nicotine?
Well, Senator, thank you for that question. And it is good to see you. You were my governor in Massachusetts when I first moved there for medical training. So it's nice to see you in person.
I take full credit for that.
Thank you. Listen, I share your passion for this subject. When I was Surgeon General, I issued the first federal report on e-cigarettes in youth, and I still am deeply concerned that while we have seen some improvement in numbers, that there are still millions of children who are exposed to nicotine through vaping. I think that while we've taken some steps, especially at the state level, to restrict access to youth, and while we have laws saying that kids shouldn't be using this, that there are still a lot of loopholes through which kids are accessing, e-cigarettes. And I also worry about the advertising, Senator, especially online advertising, which is an easy way for these companies to get their products to kids. So if I have the privilege of being confirmed, I would certainly look forward to working with you and with the administration on ensuring that we are taking steps to protect our kids from advertising, to enforce these types of rules. And even though the Surgeon General doesn't have policy-making authority, I do think that there are parents that I encountered all across this country who are concerned about exactly what you said, about why are their kids using nicotine-based products. And so this would be an area I would love from a public education standpoint to work with you on. I think there's a lot of progress we've made, but so much more we've got to do to protect our kids.
I appreciate that. And I know that part of this process is typically some throwaway lines that we all use, which is look forward to working with you on something, but then we never see each other. But this is one I really do care about. And I really hope that you'll be able to work with the administration and the FDA that obviously has regulatory authority in this regard to say, guys, you've got to push this faster. We've got to move ahead. The analysis paralysis that goes on in government is something which the private sector could never abide. And we have to get this addressed because it is a public health emergency. I'm sorry, Dr. Levine, my time is up. I couldn't get you to respond to that as well. But thank you, Madam Chairman. Back to you.